Today, let's get to know the solution of community public health management problem based on the book Community Health Management, a problem solving approach provided by WHO. First of all, understand what is community. Community refers to a number of cell groups of cell organization gathered in a certain area to form a large collective life entity. Communities are not exactly synonymous with administrative, as the two are related, but there are also differences. Community is an important place and a valuable resource for individuals and their families in their daily life. Social activities and maintaining their own health, as well as an important factor after the health of individuals and their families. In terms of prevention work, the service group is generally based on the surrounding population as the object, with its specific several radius and scope. The spread and prevalence of many diseases are often local. The quality of local environmental condition directly affects human health. Culturally speaking, a certain region has a special local customers which directly affects people's health behavior. Therefore, health promotion and disease prevention at the community level have a very clear target. In terms of health service, taking the community as the scope, it is convenient for doctor patient communication and convenient for family and relatives to take care of patient health. For the consumption of health care, strengthening community health is also conducive to saving and reducing the burden of patients. More importantly, through the community service network, people can be organized to mobilize participation rely on the community's own strengths, improve the community's health environment, strengthen the measures conducive to the health development of the group and achieve the purpose of improving the level of social health. Then clarify the principles of community public health and its implementation in the promotion of the health of all residents of the community should follow the following principles. Put health and at the center. The first element of population health strategy is to focus on the health of the entire population. Determine that community prevention services are centered on people's health requires that our services should go beyond the scope of treating disease and focus on the health problem of the population with a broader perspective. In addition, health is not only the responsibility of the health sector, but also the common responsibility of the whole society. All departments should link their work with the health of the community residents, establish the correct concept of health for everyone for health, and strive to maintain and promote health, promote social development. For the health sector, the focus of work must shift from disease treatment to prevention of risk factors leading to disease, and the role of health promotion and disease prevention should also be changed from provide to participate. To target people, it is emphasized that community prevention services should be guided by the maintenance of the health of the entire population in the community. For example, community health education, community plans, immunization, maternal, child and elderly health care, regional nutrition, for example, to improve the health awareness of community people and change the characteristics of bad health behaviors, and all based on the interest and health of the intercommunity. free need driven. The demand referred to here is the demand that is transformed from need. The demand oriented community prevention served unfairly emphasizes the pinches and accessibility of the several targeted because each community has its own culture background and environmental context. Community prevention services should be based on the actual situation and objective needs of the community itself. Determine the health problems that residents are concerned about, which are the problems that are easier to solve, and then determine the health problem that should be solved first, and seek solutions to the problem according to the economic level of the residents and the resources owned by the community. The development and application of appropriate technologies to provide cost-effective health services for the residents. In addition, through community diagnose community health projects tailored to the characteristics of their own communities are developed, and monitoring and evaluation are stressed during the implementation of projects, thus meeting the needs of the community themselves. For multi-department cooperation. Nowadays, with the rapid development of social and economy, many interrelated factors such as environmental population, bad living habits, and social and cultural factors jointly affect people's health. In order to reduce the mortality rate in the community. In addition to the need for community health personnel to do preventive check-ups and teach manual self-care knowledge, the family's economic income, healthcare system, the education level of husband and wife, and the proximity of health faculties are closely related to mental disease. Addressing this problem involves different sectors, and the health sectors, for example, cannot do it alone. Furthermore, many sectors within the community, such as civil affairs, education, sports, business, etc., and engaged in the health related work. Everyone gets involved. The important connotation of community health is to support communities to determine their own health needs and help people solve their own health problem. Therefore, mobilizing the participation of the whole community is a key link in community prevention service. Mass participation begins with enabling the mass themselves to immediately identify health issues that are closely related to their immediate interests. Access their risks to transform the environment are control health-related factors to ensure health living and problem health. Participation for all is not only about engineering people in matters related to their own health, but also about evolution. Them in decision-making activities such as identifying health problems in the community, planning and evaluating community preventive service. How to solve a series of problems brought about by community public health management. From the book Community Health Management, a problem-solving approach, we can learn that solving community public health management problems needs to be divided into 11 parties, including community profiles, problem definition, problem analysis, site visits, finalizing problem definition and analysis, idea generation and solution decision, goals setting, solution implementation plan. Monitoring and evaluation plan, project documentation, and final team project presentation. The first part, understand the communication overview. This include demographics, social infrastructure, culture, social culture contradiction and economic contradiction. Analysis of the current advantages and disadvantages of local delivery of health service. Information available in the community is also reviewed, and key elements are selected to provide a comprehensive picture, including demographics, health and education profiles, as well as social, economic, or evaluation conditions. As the team, we need to prepare a summary of the main features, an inventory of the health and social infrastructure, health faculties, equipment, human resource, schools, religions, faculties, social and development centers, no governmental organizations is then compared. Manager discusses with an open mind the various features of health service at all levels to identify strengths and weakness. Example, faculties, equipment, staff, organization names to satisfactory coverage of target groups. Collaboration with community leaders and other sectors. The second part, problem definition, reveals the data available for the previous calendar year and prepares a list of data relevant to the selected problem. For example, data related to morbidity, mortality, several coverage criteria of service. Additionally, any other health problems of service that have an impact on the selected issue. For example, high prevalence of alcohol and artificial feeding is associated with malnutrition in young child. Low breast width is associated with low antenatal care coverage and short birth intervals. Identify relation date. If the statement of the problem is vague or no specific, discuss it based on the available data and use the appropriate wording to agree on the specific statement of the choose problem. The statement should be short and specific. Review the applied molecular data over the past 3 to 5 years and compared a chart showing trends in health problem. Compare trends with other begins if dates are available. In detail health status in detection, for example, infant mortality rate, prevalence of diarrhea in child under 5, prevalence of low birth weight, prevalence of breastfeeding to quickly the extent of the problem. Service indicators, for example, immunization coverage, antenatal care coverage, proportion of pregnant women receiving aerial tables, number of the health promotion meetings per month, and the indicators which have an impact on the indicated health indicators. Identify difficult indicators such as concentrations affecting server's performance. For example, high levels of vaccinations in adult or irregular supply of medicines, lack of laboratory equipment, lack of staff trains in specific skills, lack of transport, negative quickly attitudes towards specific servers, high illiteracy rates, high proportion of the people living in the remote areas. To emphasize where where many constraints may be identified. Only then that health teams and their community patients partners can reduce in the short term should be focused on. Then choose the most important identifier and defines the number rate and denominator separately if applicable. See Table 1a. Compare a list of missing data needed to calculate indicators collected by health centers and indicate the service. Identify any additional addition date that the team considers important and easy to collect. For example, prevalence of artificial feedings, age of supplemental feeding for infants, customer satisfaction with servers, risks to finally planning servers. The seconded indicators were reviewed, added the provided template, and the SU definition table was prepared as shown in Table 1b. Part 3. Problem analysis. Process that the team is familiar with which, and one that raises awareness of the links between health and various environmental factors. For example, physical, cultural, social, economic. All the process team needs to do is make a comprehensive evaluation of the cause of the problem, including service defects. Then filter the ideas, identify the main cause and influencing factors, and categorize them. Select primary cause and contributing factors that health teams can address individually, immediately, or in a short period of time, or in collaboration with the community and other sectors. For example, health system or equipment in the middle draw problem. The main cost and their influencing factors, the relative importance of the different costs can be reflected by the size of the boxer used in the chart. For example, Figure 3 revealed the problem definition table from Sense 3 and from Sense 2 and the problem diagram to determine consistency between the two. This will help identify and list addition information to be collected. Part 4 Field trip. A site visit so that any missing or other data can be collected. The record of the date checked and its reliability assessed. Field visit to health facilities. When team visit health facilities, they should check for consistency between the date recorded in the register and the date recorded in the most reports. They should also check that date is being recorded regularly and correctly, and clarify the reliability of certain types of data. For example, need to check weight, height, blood pressure, laboratory tests. The team should check the consistency of the record data and whether the measuring instruments is working properly and being used correctly. Prepared a team report that focus on the quality, regularity, and consistency of the observed data, which may vary with staff. Part 5 Finalizing the definition and analysis of the question. Reviewing the table of question definitions made previously and discussing the accuracy of the data used to quantify each indicator based on the information obtained from the field visit. Link the selected indicators to the identified cost and finalize the problem map. The latter should be clearly distinguished and constant. If necessary, review the community profile from the second cell to make it shorter and clear. Part 6 Idea generation and solution design. This part of the team is required to review cultural health activities are amid and addressing the problem, focusing on its weakness and shortcomings. Refer to problem diagram and use normal group on brainstorming teachable techniques to generate ideas for reducing or solving problem. The proposed ideas are then circled and those that are important and can be implemented by the health circled along on or in partnership with community leaders and other relevant sector and relevant sector are retained. Categories circulated ideas into specific categories to create a cohesive list. Construct a screen grid to evaluate the feasibility of the selected idea and its likely effectiveness. The parameters used include available resource, willingness to engage the community, willingness to cooperate with other schools, like table 2. Refer to the main cause in the problem map and the list of ideas, categories, and defines the main cause of action or strategy. For example, to reduce infant mortality, the strategy will have two aspects: improving child care and improving mental care. That's a solution diagram similar to the problem diagram. The diagram should show the goal of the solution in the middle, along with the main strategy and its specific activities to reduce costs or earballs and around the edge. See example figure 4. Prepared a description of the solution, including a problem statement, trends, and main cause. B. Solution strategy and main activities. And C. Locate available records. Part 7. Setting goals where the team looks at the problem definition table, the problem diagram and the solution diagram, and checks for consistency between the three products from the problem definition table. Select health metrics that are more sensitive in measuring changes in the health of concerns and several performance metrics that are likely to change with the solution. Refer to the baseline, the level of metrics in the previous year's calendar. Consider the level of accuracy of the date and use the team's experience to define realistic goals that can be achieved within a year, based on the provided template as shown in Table 3. Compare a table containing the selected indicators, their baseline and desired goals. Part 8. Developing the solution and implementation plan. The team refers to the solution diagram to prepare the detailed business activities and steps necessary to implement the designed strategy and activity. For example, train requires preparation steps, interviewing trainers, developing training problems and materials, blockgating and identifying records. Check the alignment of activities with goals using the provided template like Tab 4. Prioritize activities and prepare an implementation plan. State the expected records of each activity. Results should be as measurable as possible in order to assess the effectiveness of activities. For example, training leaders to more staff being trained or more staff being acquired with new skills. Health information and promotion will lead to a change in knowledge or attitude, or change in knowledge, attitude, and behaviors. In order to measure the results of certain activities, the team needs to define what to measure and then determine how to collect the information. Teams may ask more experienced colleagues or other physicians to help them these tools to collate the information they need. For example, new registration forms, extra interview questionnaires, surveys, major performance evaluations studies, several quarterly observation, etc. and etc. Specify how each activity will be recorded, like meetings in the form of minutes, records of decision taken, and arrangement for follow-up activities. Training is documented in the form of a reps that describes how the training was conducted. Activity to document mention is useful when evaluating the results of specified activities or progress towards achieving objectives. Prepare gentle and chat and arrange implementation process. Part 9. Monitoring and evaluation plan. Using the target table from Part 8 for Part 7, selecting the most sensitive health and service performance indicators to measure the rate of progress and change. These indicators will indirectly reference changes in other indicators for which targets have been set and which can be measured in mid-term and final evaluations. The number of indicators is limited for ease of monitoring, as in indicators of quality and rarely used. Teams are asked to consider measures such as change in the quality of care, changes within the community as a result of health promotion, customer certification, etc. Refer to the planned activity and their expected result from Part 8. Define indicators to measure this change and the most of gathering information using the templates provided like Table 5 and Table 6. Amounting and evolution plan inducting curves and selected indicators was prepared. That if teams are not familiar with clean, most of generating quantitative information, they should seek help from colleges at the directors or other level. Define monitoring or evolution cycles or intervals for different inductors according to the format provided. Prepare a table listing all the inductors selected. Prepare a note on how to follow up and material frequency of meetings of groups members and the objective of those meetings, allocation of responsibilities, steps taken to improve data quality. How data is collected to measure progress or change. The group's invested way to work with community managers and other districts. Party 10. Document the project where the team reviews all products from previous meetings to make sure they are in their final state and takes into account observation and comments made by the team during daily presentations. Prepared with ideas for best and comprehensive presentation of the project, including a very short summary of the community profiled containing the key points most used to the project issue and solution chat 1 to 4. Tip 3 selected only a few activities as examples. Include a jet chat for all activities, a brief summary of the tracking and monitoring process prepare project documents according to the outline. The presentation should explain the steps followed during the workshop. Once ready, the team should start rehearsing not to workshop coordinators prior to the state of the session. The workshop evaluation questionnaire should be distributed to participants to complete and return it to the workshop coordinator for analysis. The final part the presentation of the team project plan. This part is the process of the team listening to the feedback of the representatives on the project results and evaluating the project. It is also the process of the team enjoying the completion of the project. That's my report. Thank you.